Hello, my name is Gabe Howard and I am one of the authors of Anxiety-Schmanxiety on healthyplace.com. This week we're going to be discussing co-occurring disorders. I was diagnosed with bipolar disorder first when I was in the psychiatric hospital. I presented with depression, I was suicidal at the time, and through the intake they discovered that I'd had a lot of highs and mania. So the diagnosis of bipolar disorder was relatively simple for them. When I got out of the hospital, I started having other issues and being able to report back other issues as I got well. In the beginning, I started to think that a lot of the things that I was having, the anxiousness, the paranoia, etc., were tied to the bipolar disorder. I thought these were symptoms of bipolar disorder. Through working with my psychiatrist and psychologist, I realized that I also had generalized anxiety disorder. At first I was like, well, wait a minute, does this mean that I'm twice as mentally ill? Am I twice as sick? There probably is a little bit of wisdom in that I do have two illnesses that can exist separately. So it was sort of hard for me to tell, am I having an anxiety issue? Am I having a bipolar issue? And how do you treat that? Do I need more bipolar medications? Do I need therapy that works for bipolar disorder? And it was hard to tease those two out. Through working with my doctors and through working with therapy and through working in peer support and reading online, etc., I was able to sort of tease those out. And I realized that often the panic attacks would come after maybe a manic issue, etc. It all ties together into an illness that is very personal to me, and while I may have traits in common with my peers, my journey through mental illness is my own. The goal, however, for all of us is always the same, which is wellness. So no matter how you call it, no matter what my illness is, I always just strive to be Gabe that is living well.